sometimes makes it easier on patients. You can set your vertical angle at something positive, since you know it's going to be positive when you use the paralleling technique on the maxillary arch. Set your posterior horizontal angle. You can use the jawline or the outer canthus of the eye. And then lift your PID up above so that you can see the teeth. Stand at the patient's ear. Hold the stabe like this. Put it in the patient's mouth with the stabe in full contact with the occlusal surface of the maxillary teeth. Make sure you're covering up all of the second bicuspid. Gently close the dexter just to hold the film in place where you had it. Look from the front. Make sure that you understand that the angle is parallel to the teeth, and bring in your PID parallel to the film. Run your finger off the bottom of the PID to make sure you're clearing the stabe, and the mesial of the PID to make sure you're clearing the film. You can also do a double check for the horizontal angle and cone cutting with the outer canthus of the eye lining up with your primary beam. Press pause. There you go. Good idea. All right. Maxillary, premolar, periapical. Load your film in the mid part of the stabe. Set your horizontal angle according to the jawline. Set your vertical angle at something positive. Stand at the patient's ear. Set the stabe on the coronal portion of the teeth. Make sure you're covering up all of the cuspid. Gently close the patient to hold the film in place. Look at the angulation of the film. It should be towards the midline. And line up your PID parallel to the angle of the teeth in the film. Make sure that your stabe is centered over, or that your PID is centered over the stabe. You can run your finger off the bottom of the PID and the mesial of the PID to make sure that it will be in place. Your primary beam should be lined up with your pupil.